Papillary thyroid carcinoma, PTC, is the most common type of thyroid cancer. It starts in the cells that make thyroid hormones and usually grows slowly. Think of the thyroid as a small butterfly-shaped balloon in the front of your neck that helps control metabolism. In PTC, a few cells become abnormal and form a tiny lump, similar to how a single weed can appear in a garden. The exact cause of PTC is often unknown, but several risk factors increase the chance of getting it. Exposure to high levels of radiation, especially during childhood, for example, radiation therapy for acne or head-neck scans. A family history of thyroid cancer or inherited genetic changes, like the RET/PTC rearrangement. Certain dietary deficiencies, such as low iodine, can make the thyroid more vulnerable. Imagine a garden that gets too much sun, radiation, or has poor soil, iodine deficiency. Weeds are more likely to sprout. Most people with PTC notice a small, painless lump in the front of the neck, swelling or a feeling of fullness in the throat, hoarseness or changes in voice if the tumor presses on the voice box, trouble swallowing, or a constant cough. These symptoms are similar to a small pebble stuck in a shoe. It may be barely noticeable at first, but can cause discomfort over time. Doctors usually find PTC through a neck exam and an ultrasound scan that shows the shape of the thyroid. If something looks suspicious, a fine needle biopsy, a tiny needle takes a few cells for lab testing, is done. Treatment often involves surgery to remove part or all of the thyroid, like pulling out a weed with its roots. Radioactive iodine therapy after surgery to destroy any remaining cancer cells. Thyroid hormone pills to replace the hormone the thyroid can no longer make. Follow-up blood tests and scans are used to watch for any return of the cancer. Because the main known risk is radiation, the best prevention steps are: avoid unnecessary X-rays or CT scans, especially for children. Use protective shields if medical imaging near the neck is needed. Maintain adequate iodine intake through diet, iodized salt, dairy, seafood. Know your family history and discuss it with a doctor. Early screening can catch problems before they grow. Molecular testing that looks for specific gene changes like BRAFV600E to predict how aggressive the tumor might be and choose the right treatment. Targeted drugs, for example kinase inhibitors, that attack cancer cells with these specific mutations, similar to using a precise weed killer instead of spraying the whole garden. Less invasive surgery techniques, such as robotic or endoscopic approaches, which lead to smaller scars and quicker recovery.